Today was the annual World AIDS Day event at the State House, and ABCD has been a leading partner in making sure that every year the state recognizes that HIV is happening in our community, that people are getting tested and offering those services for people. One of the things that we're able to do today is learn some new information given to us by doctors, by researchers about the good things that have been happening in the state as well as the challenges. We still have the same number of people that are getting infected. It was declining, but we need to do better.
There will continue to be nearly 700 new HIV diagnoses each year in Massachusetts. If there's any place in the United States that can truly get to zero new infections, ours is the state that can accomplish this goal.
This is our 5th annual here at the State House. So I'm excited because my boss, State Representative Gloria Fox, partnered with Carl Shortino and State Representative Sarah Peak to host World AIDS Day at the State House to bring awareness to the constituency of the Commonwealth of Massachusetts.
We have lots of reasons to be hopeful. The tools that we have to prevent the spread of HIV and to successfully treat people with HIV are far superior than what I think people realize and have improved dramatically in the last few years. I'm hopeful because as someone living with HIV, I know I can live a long, healthy life. And with something like PrEP, pre-exposure prophylaxis, we know we can prevent the spread of HIV to others that are uninfected.
What we see a lot is that when you talk to people about PrEP, you talk to them about risk, and you talk to them about what they're actually doing, and they feel comfortable, they are more than willing to go and talk to a doctor.
I started working on the epidemic when it started because I was seeing patients at Fenway Health back in the early 80s, and some of these individuals were people living with HIV even before we knew what was causing the epidemic. Recent studies now show that starting the medicine as soon as you know you're infected actually is helpful for you. Some of the work's been going on here in Boston at Fenway Health, but there's lots of information out there, so we hope people will take advantage of that so they can be informed and make good decisions for themselves.
Nearly 50% of the people with HIV are now over the age of 50. Jim Campbell has been fighting the fight since the early 80s, and we miss him terribly.
We miss his spirit. We watched his fight, and we're very proud of the way he conducted himself.
Just hearing some of the history and understanding how much work has been done helps all of us refocus on how much work we have to do. I was around when this epidemic started and remember the fear and remember the people that I lost. It's really good to hear the positive work that's been done is as substantial as it is.
One of the things that we've done with Test Boston is to try to bring testing into non-clinical settings so that community members that would not present into a clinical setting would actually take the test.
Safer is Sexy is a social media campaign that we have at ABCD Health Services. It stands for Sophisticated, Empowered, Extraordinary You, and it's a campaign that we use to educate young women, especially Black and Latino women in our community, about HIV and AIDS, providing information about testing sites, as well as making sure that we have a testing site that's in our office after work hours.
Continue the conversations in your households. Continue to support your local organizations and not forget about your local organizations.
HIV and AIDS is an important issue. We have to know about it. We have to keep talking about it until we get to zero.
To get more information about Safer is Sexy, you can go on abcd.org. You can also follow our social media campaign on Instagram, Twitter, and Facebook. Just search the hashtag Safer is Sexy and you'll be able to pull up all our accounts.